So hi ladies, my name is Becca and I'm one of the nurses that work here at the HIV/AIDS clinic at VGH. So today you guys are starting your clinical experience. How comfortable are you guys feeling right now?
I feel really confident. I'm ready to get started, and I read all the readings and did the assignment. I have a lot of gay and lesbian friends. Actually, my best friend is gay. So I feel pretty confident that I'll be able to talk to them.
I did all the readings and assignments too, but I'm still a little uncomfortable and unsure about working in this environment. I haven't really encountered anyone from the LGBT community before.
Okay, well I really like your enthusiasm and it's totally okay to be nervous. Hopefully I can ease your mind before you start your first day tomorrow and make you feel a little more comfortable. If you still feel uncomfortable though, you will be shadowing a nurse. So you could definitely be learning from them along the way. So before we start our tour, do you guys have any questions for me?
Yeah, like I said, I'm a little bit uncomfortable, so how can I overcome this barrier?
Yeah, so usually we feel uncomfortable in situations because of our own assumptions, beliefs, and attitudes. So for example, if you've never really known someone who's gay, lesbian, bisexual, or transgender, you probably haven't really explored your attitudes or beliefs on homosexuality. So I suggest that you take the time tonight, reflect, maybe write in a journal, and think about what homosexuality and heterosexuality mean to you. What are some of the differences? What are some of the myths and stereotypes that come to mind? You might want to try Googling some of them, finding out if any of these are actually true. So by engaging and self-reflecting, you can identify your own attitudes, and then slowly you'll just start working to change those attitudes.
Yeah, I think that would help a lot.
Yeah, so I have a question for you guys. In your readings, it suggested that acting as a neutral healthcare provider can actually be seen as a negative response. So what do you guys recommend is the best way to act, or like what approach would you guys take?
Well, I think you would just be like really friendly to them, and you can just tell them like you totally understand and that you have lots of friends that are the same way as them.
Okay, so if I were to say the same way as them, that may be interpreted as a form of exclusion, and we want to do the opposite when they come here. So we want them to feel included and safe, as a safe place to be.
Right, absolutely.
I was thinking maybe just by acting in an understanding way.
Right, so acting in a neutral manner, although usually done as a means to be accessible and acceptable, can have some really negative results. If you're acting neutral, you might not ask about your client's sexual orientation or ignore their disclosure in an attempt to be accepting and non-judgmental. However, doing so can result in missing out on important conversation, or it can hinder the development of trust, and it can also be interpreted by the client as ignorance.
So why is it important to ask about sexual orientation and sexual behavior when it's not even really a big deal? Like, I'm assuming that people who work here have no problems with it.
Right, okay, so that might be the case, but it's still a really sensitive topic to a lot of people, especially because every person is different and unique and they have a different upbringing. So actually both these questions are important to ask and do not mean the same thing. Often it's assumed that someone who identifies as being gay is having anal intercourse, a thought that has been influenced by the rates of HIV among men who have sex with men. So this can lead to the health provider focusing on the client's sexual risks rather than looking at the client as a whole. It should also be noted that not all gay men have anal intercourse and can be engaging in other sexual behaviors that should also be discussed. Okay, so any other questions?
Yeah, I just have one more question. So what are some important topics and questions that we should be asking during our initial assessments? And how do you ask sensitive questions without making it uncomfortable?
Right, so mental health issues are a major concern for this population, particularly depression. So this can be due to a lack of social support, low self-esteem, discrimination, or rejection. So asking questions about the client's support networks, family, relationships, and coping mechanisms is really important. Also, asking sensitive questions can be uncomfortable no matter who the client is, right? So just remember to keep in mind that the client is in a vulnerable position, and should be made comfortable at all times with respectful communication and body language. So use inclusive language, a soft tone of voice, keep eye contact, and face the client always, right? And then one more thing I just wanted to add while I'm thinking of it, just as a reminder, make sure that your clients know that the conversation that they have with you is confidential, and the only time that the information will be shared is if it's required by law or another healthcare provider that they're working with. So also it's really easy to talk about these interactions if you are not used to seeing them all the time. But we always want to keep the patient's dignity and respect intact and keep all conversations between you and the client to yourself. So it wouldn't be appropriate to tell friends or classmates, right?
Right.
Right, okay. Okay, so let's keep moving and let's get the tour going.